Today I'm going to talk to you about what my coaching clients do who are on GLP-1 medications like Semaglutide or Tirzepatide, otherwise known as Monjouro or Ozempic or Wegovy, what they're doing to maximize results and avoid side effects and have the best outcomes. So the first thing I'm seeing they're doing is they're working with a qualified medical provider who is helping them adjust their diet and lifestyle so that they can eventually, if they want to, and most do, come off of these medications successfully and maintain their weight loss. And so that means lowering carb intake. Typically I'm seeing about 100 total carbs a day, so moving toward a higher good fat, high protein way of eating, anti-inflammatory whole foods, lowering sugar intake, lowering alcohol intake, and those are the kinds of changes that allow people to maintain the weight loss after semaglutide. Prioritizing protein is so important on these medications, and anytime you lose weight. You may have heard of some of the stories about muscle wasting on semaglutide. It's not necessarily the medications itself that's causing that. Anytime we lose weight, if we do not consume enough protein and we do not continue exercising, specifically weight-bearing exercise, we risk losing too much muscle mass in addition to the fat that we're losing. So we want to make sure we're hitting about 100 grams at least of protein every day and continuing to weight train, even at a small amount. Start slow, body weight exercises just fine, 2 to 3 days a week, and then work up from there to try to maintain that muscle mass. That's great for your metabolism as well. Don't be afraid of good fats. This is the other third thing that patients on semaglutide and Tirzepatide seem to be moving towards, and that is helping them repair their metabolisms. We're looking at staying away from trans fats, fried foods, inflammatory seed oils, and more toward the natural fats, the olive oils, and not being afraid of those. The nuts and seeds, the avocados are good fats. We want to fill up on those. Fat does not stimulate insulin. So insulin is the fat storage hormone. You've heard of insulin resistance. When we eat a high carb diet, our bodies have to push out more and more insulin to get the same amount of blood sugar out of the bloodstream, and it can be very inflammatory to the body. And when your fasting insulin is out of the optimal range, that can make weight loss very difficult. And semaglutide is one of the things that helps bring that fasting insulin down because it helps lower cravings and helps us stay away from those high carb diets like pancakes, waffles, chips, bread, all the things that we're trying to stay away from. While we're on semaglutide or Tirzepatide, these medications, nutrient density is going to be so important. These medications lower your appetite, they slow gastric emptying, so you're staying fuller longer. So if we're eating less, we need to make what we are eating really count. So everything we're eating, we want to eat the rainbow. You've probably heard that a million times. Eat really nutrient-dense, anti-inflammatory foods, fruits, vegetables, grass-fed meat, wild-caught fish, pasture-raised eggs, and give your body the nutrients it needs, because when you're eating less, we need to make sure that you're super nutrient nourished from the inside out. You're going to also want to really hydrate while on these medications. So it turns out GLP-1 medications like this lower your hunger, but they also can lower your drive for thirst. And so keeping that in mind, we want you to try to get at least half a gallon of water every day, ideally with some electrolytes in them. It's going to make you feel a whole lot better, help your energy stay up, and just help your body function optimally while you're on these medications and losing weight and flushing out toxins from all that stored fat. The next thing you're going to want to do is work with your doctor. And the ones that I've seen who have been the most successful are working with programs or practitioners who are working really closely with the patient to find the minimal effective dose for that patient. So these medications are extremely powerful at lowering heart disease risk, obviously helping lose weight, reduce the risk of diabetes, and many other things. But where you see the horror stories and the side effects are typically when someone is sent home with a pre-dosed pen, they can't adjust their dose, they're not given any coaching on how to adjust dose, maybe they don't need that high of a dose, maybe they don't need to be injecting every 7 days on the dot. These are typically injected every 7 days, but sometimes patients find their hunger is controlled for longer than that, and that is okay. And I've seen many practitioners allow patients to to play with it a little bit and to go a little bit longer between shots. If they're having side effects, they're still losing weight, let's use the minimal effective dose. So look for a provider who is who's a little more hands-on, who's going to coach you on diet and lifestyle, and who's also going to help you use the smallest dose necessary to help you lose weight. We're looking for kind of a sweet spot of about 1/2 pound to 2 pounds a week. That's healthy weight loss, that we're not going to end up with like sagging skin because we've lost weight so fast, the sort of pancake butt that people worry about. And that is going to also avoid side effects, right? And then the other bonus to this, to using the minimal effective dose, is cost, because these medications are not cheap. If you're able to use a smaller dose less often, get the same results, fewer side effects, and it's less money, that's a win-win-win for everyone involved. And then reducing alcohol intake really has helped a lot of my coaching patients who are on these medications. And the good news is, because a lot of people say, well, that seems like a really hard thing to do. Well, two things. Reducing alcohol intake tends to reduce side effects. So people who do have side effects, there's a small percentage who do, it seems like alcohol, especially sugary alcohol, are the biggest culprits. And so that's a motivation in and of itself. However, it turns out that these medications in and of themselves are reducing people's interest in alcohol. So they're reducing the drive for hunger, but people are finding, I am still drinking the same drink at the end of a party that I didn't get multiple drinks, and I just didn't even notice. So a lot of people are just reporting lowered alcohol intake in general without even trying on the medication. And that also helps lower side effects. So paying attention to that is really helpful. Another tip is getting rid of gluten. That also seems to help people not have the GI side effects, but that also helps get rid of some non-nutrient dense carbs and is very anti-inflammatory. So that's another little pro tip from some of my coaching clients they've passed on. Avoiding eating 2 to 3 hours before bed has also really helped a lot of my coaching clients. So when you're on semaglutide or these GLP-1 medications, the food you're eating is staying in your stomach longer. And so if you eat right before bed, you can imagine you're just laying down and it's kind of coming up. So the little bit of queasiness or reflux that you sometimes hear, that can be avoided by trying to make sure all of your meals are finished at least like 2 hours before bedtime. And then finally, always check with your doctor before changing any of your diet, supplements, lifestyle, exercise routines, medications. And let me know if you're having trouble finding a good practitioner, an MD, DO, NP, PA, you're looking for someone in functional medicine and can't find someone. There's just amazing ones out there, and I'm happy to try to connect you.